Hello, and thank you for joining us today. We're here with Dr. Lowe again. I'm Tabitha Cromer, the marketing manager for Tomlyn, and today we're going to talk about cats with all things. So, even if you have other questions today that's not necessarily for cats, please let us know and we'll try to answer them accordingly. So, just to let you know, I do have cats at home. I'm a huge animal lover, and in fact, I'm such a big cat fan that I have my own cat phone case set. So, I really like cats. I volunteered at many shelters in the past. Specifically helping cats. So let's go ahead and get started. Dr. Lowe will introduce himself and then we'll get started with questions.
Hello again, and my name is Jim Lowe. I am the technical services veterinarian for Tomlyn, which means I support our sales force, train them on products, visit the stores, and really try to educate the folks on the ground level to better help you when it comes to their cats and their dogs and the products that we offer. My family is a cat family as well. We have 4. I don't have a cat phone. That being said, I was in private practice for 18 years. I'm a graduate of Texas A&M and did practice primarily in mixed practice, so looked at lots of dogs and cats. So more than happy to visit with you as long as we can, about as many topics as we have. Again, these are recommendations. I'm going to give you some ideas from my experiences, what Tomlyn can offer you. But certainly anytime we're making any sort of change to the care of your pet, you want to make sure that's based off recommendations of your veterinarian.
Wonderful, thank you. So Dr. Lowe, the first question is, my cat seems to be scooting across my floor lately. What does this mean and is it dangerous?
It's probably not dangerous, but it's normally indicative of some sort of underlying problem. Certainly we want to make sure that they're using their box normally. There's no signs of constipation or something that might indicate that, where something like the Laxatone product to provide a little laxative might be needed. But more than likely it's caused by some sort of itching. That scooting can be related to something like parasites. That's a classic one, so certainly make sure your veterinarian has run a fecal analysis and make sure your animal is properly dewormed. It can be related to allergies, certainly foodborne and others. We always worry about anal sacs. I mean, while that's much more important, which are 2 small glands that secrete scent, much more of a problem in dogs, but cats do have anal glands, and if they become impacted, they become very uncomfortable, and many times that scooting is an attempt to alleviate that pressure. I've also seen cats that are extremely matted, so our long-haired cats, because cats are very fastidious in keeping themselves groomed and cleaned, if that area back there becomes soiled, if there's a hairball, if there's a small piece of fecal material dangling off there, it can drive them batty, so make sure you fully evaluate that area to make sure it's been cleaned thoroughly. So if you look at all those and we're still not able to find that issue, you might want to discuss further with your veterinarian about a potential allergy issue, and there may be some remedies that we can come up with.
You know, that's a good point because last month both my cats are indoors, and I noticed that one of my cats, she was getting matted hair around her rear end, which is very unusual for her. So she didn't seem as peppy as she normally did, and then she started having some litter stuck to her rear end. So we ended up just taking her in for just a regular checkup, and come to find out she had tapeworms, which I thought was really strange because she doesn't go outdoors and she doesn't have fleas. So anyway, the vet was able to treat her, and ever since that, you know, it went away. She's a much happier cat.
Sure.
So another question is, how can I tell if my cat has fleas? He's licking and scratching, but I don't really see anything.
Okay. Well, segues nice from tapeworms, because remember, most tapeworms, part of their life cycle is involved with fleas. So when we see tapeworms in an animal, we immediately begin to look for fleas because that tapeworm requires that flea to complete its life cycle. So certainly fleas are the most common problem with itching in cats. And the misconception is that it takes a large number of fleas to elicit itching. Cats that are especially sensitive to fleas, that have even a flea allergy, even the bite of one single flea can be too much, because it's the single bite of the single flea that sets off the immune reaction in their body that causes them to itch constantly. So we really want to evaluate that cat, especially under the belly, where there's not a lot of hair, to look for fleas or evidence of flea dirt, which is basically flea poop or the excretions of that flea, to make sure there's no evidence of that. Certainly we want to make sure they're on a good flea preventative, which there are a lot of them out there now that are safe for cats that the veterinarian can recommend. But again, going back to other causes of itching, certainly allergens, even in indoor cats. If we have new sprays in the air, if we have new polishes on the furniture, If we have new pillows on the couch, it can certainly cause irritation to our cats. Food allergies can certainly do it. So there's lots of different things that might be causing it. Food potentially, even if it's an animal that's been on the same diet for a long period of time, they can develop an intolerance to that. So again, really probably requires a full evaluation by the veterinarian, and it calls you to really go back and look if you've changed anything around the house suddenly or recently that might be irritating them a little bit too.
You know, that's a good point because now we're getting into fall. So with the changes of the leaves and the wind blowing and things like that, you go back to allergies.
And people are going to be bringing in their fall decorations, and it'll be potentially live Christmas trees in the house. So lots of new smells and scents and things that might not normally be in this time of year. This cat is now being exposed to, and that may be causing them some irritation.
Okay, great. Another question is, my cat will not take her pills. I've tried everything. What do you recommend?
I'm sure we've all seen the cartoons on how to pill a cat. It's not easy. I didn't like to do it. Unfortunately, veterinary medicine's come a long way. There are other alternatives out there. But certainly, we do have a product, ironically enough, called Pill Masker, and that's just what it is. It's a masking agent for pills. It comes as a little dough that you can certainly just poke around and prod around and hide that pill in there. Certainly, in many instances, a very nice way to give that pill, kind of fool the cat into thinking they're getting a treat. That is certainly an easy way. Again, with the technologies available now, there are lots of other ways that medications, especially if they're veterinary prescribed medications, can be put into a modality that you can then make it easier to give your cat, whether that's oral. There's even what we call transdermal now, where certain medications can be applied to the skin on the inside of the ear, and the bodies of cats readily absorb those. So lots of different ways out there. So it's just practice, but certainly instances where you can fool them into giving them a treat at the same time is often going to be the easiest.
Yeah, and I know cats, especially mine, can sometimes outsmart me, so they know when my mood changes and I'm going to give them some medicine. So this is what Dr. Lowe was talking about. It looks kind of like a Play-Doh. All you do is just pinch off the amount that you need, and then you can ball it up. You can put your pill in it. But kind of like what he just mentioned too, with my cats, I give it to them on a daily basis as a treat. So they just think, oh wow, mom's giving me something that I really like. It's bacon flavor. And when I do have to actually give them something like heartworm, then it's no big deal. They just eat it up and they don't think twice. So this is definitely a great product, highly recommended. Cat parents just absolutely love it. And dog parents too. See, another question is, my cat is terrified of being in the car, but I have to take her to my family member's house when I go away on vacation. It's about an hour drive. Is there anything I can do to calm her down?
Certainly, and again, because this is an ingrained behavior, what we have to do is try to get ahead of this as best we can. Meaning, if we're putting this animal in a crate, we need to expose her to the crate long before it's time to get in the car, because as soon as she sees the crate, then she readily begins to become worried. Her anxiety symptoms begin to ramp up. So I can use the example of my own personal family. We just relocated with our 4 cats. We brought all the crates in a week or 2 ahead of time, just stacked them in the corner, left the doors open. They were like cat condos for our cats. They loved them. They slept in them. They played in them. They very became comfortable with them. We didn't need to, but you could certainly in those areas feed them. You could apply a pheromone spray to the blankets and just get them really, really used to it over a period of a week or so. Then when it is time, then it's a lot easier to close them in there. Perhaps you've alleviated some of that. Certainly, as early as a week ahead of time too, a product like the Relax and Calm, which is going to provide a mild bit sedation, a little something to calm the stomach, calm the nerves, might help as well. And then again, getting there as quickly as possible, as safely as possible. Sometimes acclimating them to the crate, because sometimes it's just the crate itself that they get mad about. So if we can make it a more happier place, something that's there all the time, and again, promote them going in it when they're not immediately closed up and transported somewhere might help.
Yeah, that's a great idea. I know my cats don't like going to the vet. Sure. Even that's a short trip. Another question we have, is there something I can give my new kitten to make sure she's healthy and has a balanced diet with vitamins and minerals?
Well, fortunately now, today's kittens' foods are balanced in such ways that meets all their nutritional requirements depending on their age, and your veterinarian can provide any number of those. If we're simply concerned that we may not be taking in enough calories, if we want to make sure that kitten has plenty of energy, a product like the NutriCal from Tomlyn is absolutely suitable. Think about it as calories in a tube. It's just giving them added energy. So if we feel like they're not eating as much potentially as we feel they should, or as the veterinarian has recommended, it can certainly fill in a few gaps with extra calories. But as far as the vitamins and minerals, we hope it's going to be met in the quality of the diet you're feeding.
Okay, and then maybe even with like spay and neuter after the kitten.
Sure, absolutely. The NutriCal can be used in any instance where we feel like no more energy is needed. So absolutely, convalescence, an animal that's sick for some other reason and just not eating as much as. We also talk about NutriCal being used as just an energy supplement for performance animals. So not necessarily cats that we're going to take to the park, but in dogs especially that may be going to be exercising more over the weekend, that are going to be doing more and need more energy. To have that as a treat, to give them a little extra boost, is absolutely appropriate. You bet.
Okay, great. Let's see. I recently adopted a new kitten, and I'm nervous to introduce him to my adult cat at home. Do you have any tips to make this process easier?
Patience and lots of it, because especially if we're dealing with animals of different ages, that can be very difficult. Cats are pretty unique in their personalities, and it can be very difficult to incorporate it. We've experienced it ourselves. We have two of the same age that we brought in and raised at the same time, and then over the course of the last few years, we brought two other cats in, and it can take quite a while. It takes patience. It certainly takes supervision. So first, you may want to just keep that the kitten in a crate, and let the adult cat wander around, smell it, sniff it, hiss, get mad. It's going to do all that. And that may take a while to do that. Certainly, you never want to leave them unattended together. You might then advance to supervised time together, where they are able to at least sniff each other or look at each other across the room. But don't be concerned if the adult cat wants nothing to do with it and hides under the bed or moves to the other end of the house. It may be quite a while before this is going to work. The relax and calm in the older cat may help a little bit to relieve some of that anxiety and stress. But I can remember distinctly clients I had that had adopted a kitten. Actually adopted two kittens from the shelter. One was not quite old enough or was not quite in the best shape and needed to be kept in the clinic for a little while longer. So what they did is they brought one kitten home. We're loving it. Things were going great. About 2 weeks later, brought its litter mate home. And they tried to fight like cats and dogs. They acted like they didn't even know each other. And the owners panicked, thought they'd made a huge mistake. The kittens went to opposite ends of the house. And then over a period of a week or so, it all worked out. So I think one thing to really remember is patience. Don't force it. It's not the end of the world, though, if they're never the best buddies in the world. Cats are rather solitary sometimes. Our 4 cats all have unique personalities. Sometimes, yes, they're all 4 together, laying across each other on the floor. But there's other times where they have their own spots. So don't force it. And sometimes people's expectations of what they think should happen cause you to push it and just make an unfortunate situation worse. And because in most instances they'll figure things out, and they will develop a relationship that's tolerable for them and you.
That's true. In fact, a lot of times I think that's a good point not to rush it, because I think we just expect our animals to get along immediately, and the one you've always had has already had that relationship established with you, so they're familiar with you, and a new territory coming in.
They're viewed as a threat.
Yes.
So we have to try to, again, emphasize to them that we're not a threat. Make sure we spend just as much time with the older cat as we always have. Not take away from its time to devote more time to the new cute kitten. It's just, it's expectations and realizing what's actually going on in the mind of that cat.
Yeah, that's true. And also remember, too, cats love to play. And so make sure before you even introduce them that you kind of wear them out, so they're not going to see each other as a toy. So really try to play with them, especially the kittens. You guys know that kittens have a lot of energy. Play with them, make sure they're pretty much worn out, and then, like Dr. Lowe said, maybe that's a good opportunity where they could see each other across the room, maybe sniff each other, and go from there. All right, another question we have is, my cat is slightly overweight. Sounds like I wrote this. A little too fluffy. I'll try to get her to play and exercise more, but she has absolutely no interest. Are there other ways to help manage her weight?
Certainly, we need to certainly confirm what level of obesity she suffers from, just how much weight she should need to be where she should be versus where she is, and your veterinarian can support you in that. Then develop a diet that we need to stick to. We have to be just as strict and disciplined with their diet as we do with ours. And then certainly promoting activity. And promoting activity may be getting unique toys. We know for a fact cats get bored very, very easily. And so it's getting new toys. It's rotating those toys. They've got all kinds of fancy little things that'll move around, and so you have to find the right. It's just as with us. It's not rocket science. We have to control their calories, assuming they're healthy, and promote them to burn more calories. And so, rotating brand new toys, making sure they're not always exposed to the same toy over and over again. Promoting them going from room to room. Sometimes getting a kitten to give them something to, start playing with. That's not always the best in many situations, but sometimes a new playmate also helps sometimes as well.
Yeah, one thing, I actually had this concern with one of my cats. She's 13 pounds. She's very fluffy, but her veterinarian was concerned for diabetes. She's about 7 years old, and I thought, man, she just never really wants to play. But what I did is I started studying her habits when I was at home, and I noticed she got really hyper at night, like right before we went to bed. So that's actually when I play with her now, and she can run around for about 30 minutes or so, and then she definitely sleeps better throughout the night, not waking me up at 4 in the morning. But maybe just notice your cat's habits and when they want to play, and maybe the times that you're trying to have them play is when they just woke up from a nap, or maybe they just ate and they're getting really sleepy. Okay, let's see. Another one. I have 4 cats, sounds like you. And every time one becomes sick, she passes it on to her siblings. How can I keep all my cats healthy?
Yeah, very difficult question. And really it would center on if we can get a definitive diagnosis of what's wrong with the one that tends to be bringing it home to all the other guys all the time. And again, that can require a lot of testing. Sometimes it's very difficult to fully understand why. It could simply be that cat's immune system is weaker than some of the other ones, but certainly they're all going to get it at some point. So really we want to look at making sure they're all on a good plane of nutrition, they're all otherwise healthy in all other respects, that we're not bringing in potentially outside cats that have not been vetted properly that are not healthy. But as far as overall support of the 4 cats you do have, nutrition for sure, current vaccinations. Certainly work shows that lysine therapy, which is an amino acid, can support especially the respiratory health in cats. Tomlyn does offer that in a chew form, so again, it's something we can give as a treat, that we can as a supplement to potentially support the immune system in all the cats.
Yeah, in fact, I actually use the Tomlyn lysine powder. Because we have that, and it's amazing. All you do is just sprinkle a little scoop on the food, and they eat it up. I have 2 cats, so one I can tell can get that, where her immune system is definitely down. Her eyes will run, she'll sneeze sometimes, and so I don't know if it's allergies, if it's a cold, but then I'll definitely add it on her food, and if it seems like it's getting worse, I'll double the dose, maybe 1 in the morning and 1 at night. But if she starts to be looking okay, then I'll only do 1 dosage a day. But both my cats received the immune support, and they seem to be fine.
Good.
Okay, another question. My cat is in desperate need of a bath, but fights me every time he's near the water. How can I make bath time easier for both of us?
Again, we have to be realistic about what these expectations can be. And if it's an older cat, it may be very difficult. And it was very common in practice to have people bring in cats for sedation, to properly groom and or bathe them. It's just easier on everybody because, again, we don't want the cat hurt. We don't want the owners hurt just as importantly. And to force anything on them is just going to make the next time you try to do it even worse. Certainly something like the relax and calm may help if it's just mild aversion. But again, it's not waving a flag of surrender that you just ask your veterinarian, can you sedate her to have this procedure done, because in many instances it's the only way to properly do it as well. You can imagine a cat that's reluctant to get a bath, if you're able to actually get them in the tub, without losing a limb.
Yeah.
How effective a job can you really do to get done what needs to? And again, then
Right.
you've just doubled your trouble for future use. So you can certainly try some supplements. You can try wiping them down with a wet rag. You can try, our cats seem to be enchanted with our water bowls and petting them around those. But it can prove very, very difficult because cats just, it's very few that enjoy getting all that wet.
Mm-hmm. Yeah, I remember one time I'd given my cats a bath before, but I would actually get everything ready. So all the towels would be ready, the pitchers of water, so that way they don't hear the running water, because sometimes that will freak them out. So if you can get the pitchers of lukewarm water ready, you could put them in the tub, rinse them, wash them really fast, rinse them again, and get them out. But like you said, I mean, you just have to be willing to chance it.
Yeah, and again, it's not, again, if we really want to, are we really improving the quality of life of your cat by putting them through all this? If it's necessary, if it really needs to be done, then it might be better just to get it done as stress-free as possible, and that may be sedation.
So really, cats don't necessarily need baths, like...
I mean, they can certainly develop many issues, skin problems, but those can many times be managed more topically or orally, something like that, if we're dealing with some sort of infection or something. There are some instances where it's going to be required, but that's going to be working in conjunction with your veterinarian anyway, and then they'll probably have some recommendations on how to accomplish the recommended therapy.
Awesome. And if you guys have any questions, please send them our way and we'll try to answer them.
I think there's one down there at the bottom.
All right, this one says, my question is how to get Ginger to stay off the kitchen counters. Charlie stays off for the most part. We have a can of pennies to shake when Ginger jumps.
You have a can of pennies. We have a bottle with water in it, a little spray bottle. That's really the best. And now, quite honestly, if you just go to reach for the bottle, there's one culprit in our house, in particular, our youngest cat, and they see that bottle. And that's really the safest way to do it because, again, it's very difficult to figure out, why they do it. To train them to not want to do it, I just don't think that's going to be plausible. As my wife and I both work. Our daughter's at school all day, so they kind of have the run of the house when we're gone. So, but yeah, for us, the little pump sprayer with the water works really, really well.
Yeah, in fact, what I've actually taught my cats, they can count to 3. So they have until 3 until I spray them. So I'll say 1, 2, and they actually, I don't know how they know it, but they know by 3 I'm going to spray them with some water.
Oh, I just reach for it. They go running.
Okay, let's see. Is there a way to treat vertigo in a cat?
Wow. By vertigo, I would assume you would mean dizziness or maybe a head tilt or where your cat appears to be uncoordinated. And most of the time, certainly that's a veterinary evaluation that's required. We could be dealing with, external superficial ear infections, ear mites. It could even be something going on more in the inner ear. It could be related to the sinuses and pressure, congestion, infection in there. So certainly, you first have to determine why the symptoms are occurring, what the underlying problem is, and then your veterinarian can best prescribe therapy. And
probably it might do with the age of the cat as well.
There's just so many things that could be causing it. It just really would be best to start having it evaluated by your veterinarian.
Yeah. Okay. So sometimes my cat goes to the bathroom outside of her litter box even though it's clean. Could something be wrong with her digestive system?
Yeah, or in the case of our cats, they could be the signal that their litter box needs cleaning. Because certainly that's how our cats express it. One will have an accident outside the box, and for us that's the signal. It's time to clean boxes, for sure, especially with 4, as you can imagine. So certainly inappropriate elimination can be stress-related or behavior-related. But more importantly, the first thing to rule out would be some sort of pathology. If we're talking about the urinary tract, the classic is a urinary tract infection. Urinary tract infections, they'll void frequently, they'll void inappropriately, meaning they're uncomfortable, so they go wherever they feel like going. They may strain and stand in the box for extended periods of time. But going outside, I would worry about that. If they're pooping outside the box and it looks like it's loose or soft, then certainly we want to get them evaluated, have a fecal analysis done. Could it be parasitic in nature? Could it be dietary related, something like that? We want to make sure we have enough boxes. So if you recently added a cat, the theory was we have at least one more box than the number of cats in the house. Sometimes it's at least two more boxes, and then that's spread throughout. So that could be a problem if that's your situation. Have you changed the litter? That can be a huge one. Just changing the litter a little bit. Is there an adequate depth of the litter? Is another big one. Look for things that you might have changed around the house. So certainly, once you've ruled out any sort of health issue, which that would require a check by your veterinarian, make sure you've not changed any of the types of litter you've done. You might consider adding another one or two, and then going from there to look at perhaps behavioral reasons why this is occurring.
Yeah, that's great. Yeah, because I know a lot of people always ask, how could that be? Why would they be going outside the litter box?
Huge number of reasons, you bet.
And it could, one I guess could even be stress. Like if they're stressed, if you're gone for a while, or
just to get attention. I mean, potentially stress from what's in the litter box, or just stress from too much outside activity. Again, think about more so it's because they're uncomfortable or they couldn't hold it, for whatever reason, be that a urinary tract infection or an inflamed bowel where they're just very uncomfortable, and while they like to make it to the box, they just can't make it to the box potentially.
Okay. How about cats' claws? Like, do you think it's important to try to keep their nails trimmed?
Oh, I think it's absolutely beneficial to trim your cat's claws, and if you start it early enough, it is not a major procedure. If you can train them to that, you can extrude that claw very easily, and then just take the very tips off. It's very, very easy. Certainly, declawing is becoming increasingly controversial because it is a major surgery.
Yeah.
Very major surgery. There's always complications with surgery. There's always complications with anesthetic. Certainly, the technology now it's can be done very, very effectively. But in many cases, I think a cat can be managed by routinely just tipping those nails. And the earlier you start that, the veterinary technical staff at any clinic can show you how to do that, and are more than happy to show you. Or you can take them in there and have the staff do that. But to keep them tipped off, which is really what we're really wanting to do as well, I think is certainly important, and certainly as far as potential risk, much less than the declaw procedure itself.
Yeah. Yeah, I've had a lot of friends that ask, well, how do you stop a cat from scratching the couch or scratching the bed? And some things I've said is, well, make sure you at least have scratching posts, because they like to have it for their scent.
Sure. Yeah, you want to have avenues where they can scratch, absolutely. Or simply you may just have to, unfortunately, some answers to behavioral issues are easier than they may sound, but some that's not logistically possible. But if it's one piece of furniture in one room that they like to scratch, we just cut off access to that room. I mean, sometimes that may be what we have to do, especially if it's in a bedroom or something. We just don't allow them access to that room. Sometimes it's not as easy as that, but sometimes that's the only options we have available to us.
Yeah, and remember that there are cheap scratching posts. You don't always have to get the ones that are vertical. You can get the horizontal cardboard ones. I know my cats love those too. You can get them at Walmart for about $5.
Yeah. Lots of different things you can try for sure.
Yeah. Well, great. Well, we're going to wrap it up for today, so we really appreciate you joining us. Let's see. I'm sorry, we've got one more question. It is, my cat got really sick and she had worms. I gave her some worm medicine. She ended up weeks later having trouble breathing, and she wouldn't eat, and then passed away. Let's see. She had the vertigo before she passed and wouldn't walk or jump, and she would fall. I stayed with her till the very last breath. Oh no, I'm so sorry. She kept meowing because she knew something was wrong, but there were no vets around that could do anything. What do you think it could be? I think is what it says.
Wow, that is an extremely loaded question, and certainly it's an unfortunate set of circumstances. And unfortunately, not knowing any history or anything, I'm unable. Again, the vertigo is simply a symptom, and again, it's a laundry list of potential possibilities that could have been causing that. So it would have really required an intense and thorough investigation, probably some lab tests as well. But to keep or pinpoint just one possible issue, I would not be able to do at this point.
Okay. All right. Well, thank you for your questions. Let's see. What is the earliest I should be getting my pet spayed or neutered?
Wow. I would visit with your veterinarian about that, because certainly philosophies are changing, research is changing. Certainly to control the pet population, we would want to do that prior to them potentially being exposed, or where there is risk of exposure. There are advantages to doing it earlier than later potentially. So really something, visit with your veterinary care provider, and they'll give you the best recommendations for sure.
Is there an age where maybe they're like 7 years old where they shouldn't get spayed or neutered? Or I know there might be some...
Oh, I don't know necessarily whether there's ever age where they potentially shouldn't. We always weigh the risk benefit, but certainly older cats can develop infected uteruses, what we call pyometra, which can be life-threatening problems. Certainly they can develop cancers of the reproductive tract. So I would never say never. And certainly age is not always the only criteria we say we're not going to do a procedure. We have to put the whole health profile of the animal into view. And again, the veterinarian then will make their best recommendations for you.
Okay. Okay, well, thank you. We really appreciate your attention today. Thank you for being fans of Tomlyn. And if you have any other questions, let us know. We will be having another live show in October, and we will be announcing that. So thank you again, and we hope you have a wonderful week.
Thank you.